All right, so in this lesson, we're going to be talking about progressions, which is really important for our programming as well as just understanding why you program, how you program, and so on. Something that you want to consider throughout any time that you're looking at workouts, basically progressing from its simplest form to a more complicated form. So when we look at progression, first thing we talk about is progressive overload. Progressive overload is defined through the Essentials of Strength Training book as being progressively placing greater than normal demands on the exercising musculature. So as we go throughout this particular lesson, you're going to see what those different greater demands are in regards to the exercising musculature, how we can do that, how we can alter those to make things a little more complicated and progress as we move forward, so that we can see, as we said, that progress being made. So really quick though, on that Essentials of Strength Training book that we see right here, that's a book that if you ever are interested in strength training, you will have to read in order to get your certification. So I'm just kind of making a plug for that right away. So a good kind of rule of thumb that we can look at when we look at progression is the FIT principle. So FIT is basically an acronym for frequency, intensity, time, and type. So when we're looking at that and we're looking to progress, what we can do is we can alter any one or multiple of these different words right here. So frequency, what we're looking at is how often are you exercising. So this can be looked at in regards to the week itself. So how are we progressing? Maybe it starts at 2 times per week and we progress to 3 times per week, into 4 times, and so on. Intensity is going to be how difficult is the exercise. So we can look at that as being where your heart rate is at. Maybe when we're looking at conditioning, right away you want your heart rate to be between 120 beats per minute to 150, and maybe as you go on, you want to raise that up, and you want your minimum to be 130 beats per minute, and then 140, and so on. RPE is rate of perceived exertion. So that's how hard does the workout feel to you. So if you don't have something like a 1 rep max that you can have percentages from, you can use RPE and say maybe the bench press today for this set should feel like a 7 out of 10 difficulty. All right, so that's going to be something that can change depending on how you feel on a certain day, which can relate back to how much sleep you got, what you were eating, and so on. Both those can really affect your RPE. And then we can also look at the overall volume. So that's just how much weight we're using, how many sets and reps, and so on. So we can add to that. So if we're looking at the traditional sense of intensity for the weight room, we're looking at taking a 1 rep max and basing your movements off that 1 rep max, how much weight you're using. So maybe you want to perform 70% of that 1 rep max, or 80%, or 95%, and so on. Time is the length of the workout. So this can be, maybe how long you're performing the workout, how long you're going for a run. Maybe it's going to be how many movements there are. It could start out with maybe you have one block of 3 movements for the first, couple weeks, and then you move on to 2 blocks of 3 movements. So your overall volume is going up. And then lastly, the type of workout. So this is the progression of the exercise. So this is the most typical progression that you see. You do see a combination of all of these within the weight room, but odds are you're going to see a lot more when it comes to the workout or the exercise itself. We're going to take a movement that we want to see you do at the end of the program, and we're going to regress it back to its most simple form so that we can progress you to that complicated form. So if we're looking at a squat, for instance, as we see the examples down here, if we want to do a barbell front squat at the end of the summer, all right, but we're working with somebody who's never done a squat before, we're going to want to start them in the most simple form of a squat, which is going to be a bodyweight squat. From there, we can perform a counterbalance squat in which you're holding a 5-10 pound plate, and out in front, or as you squat down, you press that plate out in front of you. So that way you're going to have that counterbalance weight to it, helping you sit back and achieve that squat. From there, we can move on into a goblet squat. So we're going to take that counterbalance, we're going to turn that into a dumbbell or a kettlebell, and we're going to hold that right at our chest. So that way we have still a counterbalance piece, but it's going to be a little bit more centered for our weight. So we're still squatting down. From there, it can be a kettlebell front rack. So we're holding 2 kettlebells, and we're going to have them resting in between our forearm and our bicep as we hold our elbows up as high as we can. So that way it's almost like a bird's egg in a nest. And then eventually we move on to that barbell front squat as we see here. So we go from the simplest form, complicating it or progressing it a little by little to the point that we're now doing a much more complicated form. But because we were progressively overloading it, it's not going to be a terrible jump in which going from that to that could sometimes be impossible for an individual. So how do we apply it? Frequency, we can add an additional day to it. We can add additional workout within the day. Intensity, we can add more reps or increase the weight that's being used. Our time, we can slowly add more conditioning time. We can add more sets and reps, so we increase the length of the activity. And then type, we progress the exercise from being used or change the movement from eccentric to isometric. So sometimes our progression can be the same movement. So if we are performing a squat, as we see this guy back here, maybe we're already good at the squat, we can start with an eccentric time. So we're going to go from the top of our squat up here, and we're going to lower ourselves down for maybe 5 seconds, 3, 4, 5, hold for 1, and then squat or stand up nice and fast. Then we can do it into an isometric in which we're going down for 1, holding at the bottom, 1, 2, 3, 4, 5, and then up nice and fast. So we can always progress through the time that we're doing each movement as well. So looking at the progressions of exercises, so typically if we're looking at some big movements in the weight room, a bench press, front squat, deadlift, clean, and snatch, we can progress things like such. So bench press, our end result, we want to do a barbell bench press. We can start out with a push-up. We can really focus on the eccentrics, and then we can do like an iso and a normal push-up, followed by a dumbbell bench press, following that same pattern, eccentric, iso, normal, and then eventually into a barbell bench press. Front squat, we already talked about that, from a bodyweight squat into a counterbalance, goblet, front rack, and then a front squat. And deadlift, as we see here, is a really cool example of the progressions, giving you a visual. So we can begin by teaching what's called a hip hinge with the dowel, as we see here. That dowel, what we're looking for is we're trying to have that bar or that pipe sit on your butt, sit on your mid-back, and then on the back of your head. As you hinge back, you want to make sure that that bar is touching all 3 spots the entire time. So that way we're working on that hip hinge. During that hinge, and we'll talk more about it with our deadlift lesson, all right, you're going to want to have those hips higher than your knees. Your shins are going to stay nice and vertical so your knees don't push forward, all right? Just a slight bend. So we're calling this a lower body pull. So we're working mostly through that backside of our butt, our hamstring, and so on. From there, we can turn that into a kettlebell deadlift off the plate. So we're still working that hip hinge within these movements. You'll always see his hips are higher than his knees. All right, with that deadlift. From the kettlebell, we're going to have it raised off the ground so he doesn't have to go as far. Then we want to progress that to a deadlift from the floor. So now we have that more or a greater range of motion. From there, we can progress to a trap bar deadlift. A trap bar deadlift is going to keep that weight in the middle of your body versus progressing to a barbell deadlift in which now the weight's in the front of the body. And then from that barbell deadlift, we can regress to a deficit barbell. So you're standing on top of that box now, or that plate that we saw in the second picture, and you're going to perform that deadlift from there. So that means you're just going through a greater range of motion. A hang clean or a hang snatch, we would progress basically similar progressions. We go from a PVC banded RDL, which we'll talk about in the weeks to come, a barbell RDL, a hang pull, a hang high pull, and a hang clean, and then eventually a clean from the floor. Same with the snatch. PVC banded RDL, just now we're having a snatch grip, which you'll learn if you don't know. A barbell RDL with a snatch grip, a hang pull with a snatch grip, high pull snatch grip, hang snatch, and then a snatch from the floor. This is just another example in which we can see our progressions take place. So you see our progression is going to be that most complicated form. We want to try and progress that from a simple version. So if we look at a bilateral lower body, so a knee dominant, so that's going to be more of a squat using 2 legs. Whenever you see bilateral, that means 2 of the body parts. So in bilateral lower, you're using 2 legs. We go from bodyweight squat to a goblet to a barbell. If we want to do a unilateral lower, so now we're using 1 leg, we can do a partial range of motion split squat. So we're just not going all the way down with the split squat. into a split squat, into a rear foot elevated split squat. So our back leg is up. Upper push, horizontal. So that's going to be like a push up or a bench press. Upper pull, we can do an inverted row, horizontal, and then core as well. So that's our progressions, and we'll just continue to look back on that as we go forward.